Are you hearing me now? Are you hearing me now?
Yes, I can hear you.
Are you hearing me?
I can hear you, sir.
All right, thank
Yes,
you.
Yes,
I can hear you, sir. I can hear you now.
Okay, thank you. Is the setting from the Zoom? I think they are just the Zoom is just after 5 minutes. Another one comes up. Another one. I don't know whether it's from the admin, but let me continue. All right. So the next slide there is mediators of inflammation. So when inflammation the body responds by sending.
Hello, sir. It's breaking. I can't hear you clearly here.
We mentioned that before.
Hello, sir.
Anytime there is inflammation, the body must send chemicals to enhance inflammation. Is what mediators of inflammation are or produced by the. I'm hearing you. I'm hearing you very unclear. Okay. Can I continue? Are you okay?
Yes, you can continue. It's better now.
Are you okay? We'll continue. In progress. So let's continue. That enhance inflammation because it occurs because there are some cells that inflammation to occur are called the mediators of inflammation. And there are many types of these cells do. Some of them are coming from cells, some of them are coming from the plasma. Example of the ones that come from the plasma, from the cells are histamine, serotonin, prostaglandin, and the cytokines. Whereas the ones that come from the plasma are things like the complement proteins and the kinase. Example of kinase. All these mediators, they cause for the pain that you feel when it's that lead to inflammation. The redness because some chemicals immediately come into play. Let's look at the next slide to expatiate. Let's look at the next slide to further expand. Inflammation are either from the cell or from the plasma. Either from the cell, body cells, or from plasma. These are the sources of those chemicals of inflammation. In the cell, these inflammatory mediators, they can be preformed or newly synthesized, meaning that either they were formed and waiting for inflammation to occur, or within that short moment, they are produced immediately to cause the body to respond to inflammation. So we come to say that inflammatory mediators can be from the cell or plasma. If they are from the cell, it's either they are preformed already in the body, whereas in the plasma, they can be as precursors or inactive form. Precursors or inactive form, those are the things they have the chemicals operate. So summarily there, we can say that mediators of inflammation are from two sources. Some of them are from the cells and some of them are from the plasma. Some of them are from the cells, some of them are from the plasma. That is where the sources of mediators of inflammation come. Now, let's look at it further. The ones from the cells, like we said, is cell they were stored, and the examples of those ones are what we call active amines. Examples are histamine and serotonin. Examples of chemical mediators are histamine and synthesized, and these new metabolites. Another example is reactive oxygen species, and then oxide. These ones are
Sir, the line is breaking, sir. Sir, the line is breaking, sir. We can't hear you at all, sir. Hello, sir.
Now, let's go for that to the one that are coming from the plasma. This one from plasma derived. I think it's are you? Is it clear now? Hear me now. Can I continue? Response.
Yes, sir.
Can I continue?
Yes, sir. But we didn't hear you. Yes, sir. But we lost what you said for some minutes.
Okay, so I okay, you did not lose much. What I saw is that what I said is that the mediators of inflammation are two types. We have the cell-derived, and then we also have the plasma-derived. I want to talk about the plasma-derived chemical mediators. Can I proceed now?
Yes, sir. Thank you, sir.
All right. Yeah, Adeze, thank you very much for what you're doing. Please keep recording that thing to be clear. Later we retract it. I'm also recording so that we don't lose anything. Thank you so much, Adeze. All right, so now for the plasma derived, we say that all the plasma derived mediators are produced from the liver. So they circulate in the plasma in inactive form, and then they become activated during inflammation. What are the examples of plasma derived mediators? We have two major types. The first one is a complement system. The second one is the kinase system. The complement system are the ones that are in charge of opsonization, chemotaxis. They attract the immune cells that kill the bacteria and so forth. Then we also have the kinase system, which causes the blood to come to the place where there is inflammation and cause that swelling that you normally see when there is inflammation, leading to pain. So, but summary is that plasma-derived mediators are majorly complement system and the kinase system. While the cell-derived, we have the preformed and the newly synthesized ones with examples we give you. Now look at this, diagram. This diagram gives us a summary of the chemical mediators. The first thing to see is that chemical mediators are either from the cell or from the plasma. If it is from the cell, it can be preformed or newly synthesized. If it is preformed, example of such are histamine and serotonin. If it is newly synthesized, example are prostaglandins, leukotrienes, platelet activating factor, reactive oxygen species, nitric oxide, cytokines, and neuropeptide. All these ones are cell-derived chemical mediators. Then we go to the second one, which is a plasma-derived cell mediators, inflammatory mediators. Like we said, all of them are from the liver. The major source is from the liver. Once the liver produces them, they are released into the plasma. They are released into the plasma, which is the blood, part of the blood. And that will be example of such include the complement system and the kinase system. Complement system here, and then the kinase system. Those are the examples of the sources of chemical mediators. This table now also is saying the same thing. We have the cell-derived. Example is histamine, serotonin, prostaglandin, leukotrienes, platelet activating factor, nitric oxide, chemokines. All of them are the one from the cell. The plasma protein derived are complements and the kinase with examples. All of them majorly are produced from the liver. This table is saying the same thing. So let's move further. Let's move further. So this table, this diagram is also saying the same thing. Cell-derived mediators produced locally at the site of inflammation, while plasma-derived mediators are produced by the liver, circulate in the plasma in inactive form, and then when inflammation comes, they become activated and form inflammatory responses. Again, this table is saying the same thing. So we have 4 slides saying the same thing about. So now, let's go to the next thing. What are the laboratory tests you can do for inflammation? Whenever there's inflammation, some tests can be done. 2 major ones exist. We check for the level of C-reactive protein and also for erythrocyte sedimentation rate. When we measure erythrocyte sedimentation rate and C-reactive protein, if inflammation has occurred, usually the levels of these 2 parameters will go up, meaning that inflammation just occurred. This is one of the things we use to check inflammation, these 2 tests. All right, let's move on. Now let's go to natural medicine. Are there foods that can cause inflammation? We know that inflammation is a way the body protects itself, and if it is excess, it can become a chronic inflammation. Some food are known to enhance inflammation, especially chronic inflammation. That is why you see us tell to some people, don't eat this food because it will worsen the cancer. Don't eat this other food because it will worsen the diabetes. Don't eat the other food. Don't eat that. It's not because the food per se is a problem. It's because of the effect of the food. For instance, someone that has hypertension, has diabetes, has arthritis, has atherosclerosis, and is eating a lot of red meat. That red meat is going to worsen those conditions. That is why we tell them, please avoid such food because some food can cause inflammatory responses. So what exactly are some of these, what exactly are some of the food that can enhance inflammatory responses? So we say number 1, red meat. Number 2, processed meat such as lunch meat, sausage, and bacon. This is common among the whites. Then we also have store-bought baked goods such as cake, pies, brownies, cupcake. All of them have high calorie, and high glucose carbohydrates. The bread and pasta made from white flour is high-level carbohydrates. Fried foods, and of course, a lot of food that contains sugar, Coca-Cola, everyday Coke, and the person is very fat, or the person is having issues with diabetes, or alcohol, all the time alcohol, and yet the blood pressure is high. So this can cause and worsen the inflammation. Other things are refined carbohydrates, such as white bread and pastries, French fries, and other fried food. Soda, what the Americans call soda is what we call mineral in Nigeria. He's drinking mineral. The white man will say, you're drinking soda? Yeah, I'm taking soda. Yeah, that is soda. Soda is actually high sugar sweetened beverages. It's not too safe for people that are advanced and they have problems with glucose control. Red meat, steaks, burgers, processed meat, hot dogs, sausages, margarine. Margarine contains a high level of cholesterol. So if somebody has high blood pressure and is taking a lot of margarine, that will increase the blood pressure because this fat will get. Remember, we talked about what was that topic with Madam Miriam? We talked about the blood vessel being blocked by fat. Remember, I think that was some few days ago we took that. That is where margarine comes in, lard and all those stuff. Those are things that can worsen So do we also have anti-inflammatory food? Yes, there are some fruits that are very, very beneficial. Tomatoes, olive oil. Olive oil is preferred to some other saturated oil. Then we also have things like vegetables like spinach, collards, nut like almonds and walnut, fatty fish like salmon, mackerel, tuna, and sardine. Please take note of what I want to say now. Cholesterol in the body is not a good thing, but it's protective. It has the body, it's what keeps us warm. It what helps the membrane of the cells to carry a reaction. But when cholesterol is too much, it becomes a problem. So if one has a choice to make between fish and meat, please, it has been found out scientifically that fish has the good cholesterol and is very protective to the heart. If you have someone that is always taking red meat, it is not too safe. But fish is protective. That's why we said things like salmon, mackerel, tuna, sardines, fish, because of the omega H3 oil that is found in them, they are very protective. These ones are anti-inflammatory, so they are protective. Then we have things like fruits, like strawberries, blueberries, cherries, and oranges. Fruits contain what we call antioxidants. An antioxidant mop up free radicals. It is these free radicals that cause inflammation. So when you take fruits, you are increasing your level of antioxidants, and then antioxidant will mop up the free radicals. It is these free radicals that cause cancer and cause inflammation. So when you take fruit, you are protecting your body from those free radicals. Let me proceed. Yeah, okay, this is just the same thing I've said. They are things high in antioxidants. These are anti-inflammatory substances. They are antioxidants. Example is tea, green tea, white tea, black tea. They contain polyphenols, which fight inflammation. Coffee also has polyphenol, which fights inflammation. Juices such as orange juice, pineapple juice, tomato juice, and carrot, they have high amount of vitamin C. And vitamin C is an antioxidant. It mops off free radicals. Red wine, to an extent, also have some inflammatory effect. Though research is not clear, some have two views. So we are not telling you now and take red wine. I'm not advocating that. That is a research, neither here nor there for now. Water, natural water, taking a lot of water is very helpful because it flushes the toxins out of your system and keeps your joints lubricated. That can actually prevent or suppress the osteoarthritis, which is one of the things that come up as a result of chronic inflammation. Now, let's go to something, okay, the food and fruits. These are some of them. Food that fight inflammation. Vegetables like tomatoes, fruit, strawberries, cherries, leafy vegetables, and so forth, olive oil, and then all that. Now, it's good for us to know that when there is inflammation, it can cause damage to tissues. Now, that damaged tissue, the body is always wanting to repair it. That is what is taking us to the next topic, healing and repair. Healing and repair are complex processes that replace damaged tissue and restore function after an injury. So usually when your body has undergone inflammation, the body will repair it. Let me give you an instance. Let's use the instance we gave earlier. You are cutting something with a knife in the kitchen and the knife cut your hand, and then there is an open wound. The blade becomes painful, becomes swollen, becomes red, and after some 3, 4, 5 days, everything goes off. Inflammation stops. Even though inflammation has stopped on the surface, the body is still healing that part of your body. The body is still healing that part of your body. That is why that healing is still ongoing. Even though the skin has closed, but the healing is still ongoing. So that takes us to how exactly does the body heal itself? There are 4 stages of healing. We call them the 4 stages of repair or 4 stages of healing. So the 4 stages are hemostasis, inflammation, proliferation, and remodeling. I will explain them in a short while, but before I do that, let's look at what happened. Hemostasis. Look at it. Immediately after an injury, like for instance, you cut yourself with a knife, the blood vessels around that area will constrict, meaning the blood in them, they begin to get tight. Yeah, that's what happened. The blood vessel becomes tight, so that blood is not flowing too much to that area. If blood continues to flow, you know that person can bleed to death. So the body has a natural mechanism. Once you cut yourself with a knife, that part of the blood vessel that's around that area will quickly close its mouth. Blood will come for some time, but after some time, blood will stop. That is what we call vasoconstriction. The whole essence is to reduce blood loss. After that, platelets, which is part of the red white blood cell, will arrive at the wound and form a plug to block that hole so that bleeding also stops. After that, clotting factors that enhance blood clotting, they will all come to that place, form a fibrin, and further stop the bleeding. And that is the first step. That first step, all this one that we have seen is called the body has arrested the bleeding. This is the one that you see after the second day. You see that that place is painful, that place is hurting you, that place is so. This phase begins within hours after the injury and can last for some days. White blood cells, just as neutrophil and macrophage, they rush to that site. That is where you are now seeing white blood cells is the neutrophil is standing for acute inflammation. The macrophages is standing for chronic inflammation. They all inflammatory cells come to that site and they go through the process of inflammation. After inflammation is over, the next stage is proliferation. In this proliferation, you know the tissue was cut before, so the body begins to form a new tissue to fill up the wound that has existed. That stage is called proliferation. And under proliferation, we have two things that happen there. We have granulation. And granulation means that we are having new blood vessels are forming around there. Remember, the one that was there, you cut it. So new blood vessels begin to form. The formation of new blood vessels is called angiogenesis. Then we also have granulation tissue. Granulation tissue are the tissues that enhance the healing of that part. Then we also have the next thing called epithelialization. New skin cells begin to migrate to cover the wound surface. One part of the skin on one side joins with the other part of the skin on the other side. It was called before. They are now joining to form a complete union. Let's illustrate this by picture. Okay, then the final phase is remodeling. This is the longest phase. It can last for months or years. It involves the formation of scar tissue, fibroblasts, and more other cells. This one, it can take long. That is why when you have a surgery done on your part, on your body, the skin will close, but under that skin, the healing will still be on for weeks, for months, for sometimes even years. That is remodeling. Remodeling is the longest phase of repair. It can take a long time. I just hope you actually understand it, but let me illustrate it with this picture. This picture is telling us about hemostasis. There is a cut, blood clot comes in. There's a clearer picture. After that, there's inflammation. After that, there's a proliferative phase. After that, there's remodeling. I think there's a clearer picture somewhere. Stages of wound healing. Hemostasis. The body stops the bleeding. Inflammation. Inflammatory cells come into the proliferation. New cells are formed. New skin is formed. Then remodeling, which can take a long time. I think there is a picture ahead. Yeah, this is it. This particular picture is clearer. Look at it. In hemostasis, the bleeding stops after you've cut your skin, a part of your body with a knife. Now, the next thing is inflammation. All those inflammation, the body is trying to defend itself from that cut that you've had. The next thing is repairing the part that was cut. That is the proliferation stage. Now look at the wound in the first picture. Like this needle has entered the skin. The needle has been removed. Inflammation has started. Look at proliferation. You see that the wound is now smaller. The wound is smaller because the body is trying to close that wound small. After it has closed it, the next phase is maturation. Under maturation, the skin has joined though, but inside under the skin, the processes of joining is still ongoing. I hope you understand. Please let me have a response. Do you even understand what I'm talking about here? Hello.
Yes,
I hope you
yes,
understand.
yes, sir.
Okay.
Exactly.
Yes.
Sir.
Thank you very much. I'm
Okay.
grateful. All right. So
Hello,
let me.
sir. Good afternoon, sir.
Yeah, Rabiat, how are you?
Yes, fine, sir. I asked
Okay.
you some questions. There are some questions in the chat, sir. When you are
Okay.
divining, when you are explaining the difference between the, what is it called, the acute inflammation and the chronic,
Yes.
when I was looking at it, I saw that there are some cells that they are in acute and they are also in the chronic, like
Yes.
monocyte,
Monocytes.
megaphase or something.
Okay. The reason is because
Megaphage.
yes, macrophages. Macrophage. The reason is because it's a transition. It's a transition. If you are moving from Lagos to Ogun State. In between, you see border towns like Mowe, Redeem. You cannot say this person is in Lagos or is in Ogun State. You can have part of Lagos, you can have part of Ogun State joining together. That is what is happening there. But in between, you know that if you are in Lagos, this is Lagos life. If you are in Ogun State, this is Ogun State. That is what happens. Inside acute neutrophils. Inside chronic inflammation, the major cell is monocyte. But when there is a transition from acute to chronic, you can see these cells are coming, what is here and what is here seem to be coming together. That is why you can see those cells in the two places. But if we ask you, what is the major cell in acute inflammation? Just know that one, they are referring to what is exactly only in acute inflammation. That is neutrophils. If we ask you again, what is the major cell in chronic inflammation? They are referring to chronic inflammation, and the cell there is monocyte, which can eventually become macrophages. Rabiat, I hope it's okay. Does that answer the question?
Yes, sir. Thank you, sir. As you
Okay.
explained the Lagos to Ogun State, I get it. Like you are going to Ogun, you will still pass through Ogun State. You are going to Bini, you will still pass through Ogun State. So I understand. That is continuation of the from acute to.
That is because I need to talk in a way
understand.
that. All right, thank you. If you need something,
Yes, I
this thing Ogun
understand.
State,
Thank
yeah.
thank you.
Yes. Okay. So, yeah, let me continue to the other side of. Let me continue. So now let me see complications when a wound heals. These four stages on our the hemostasis, the proliferation, remodeling, and all that, they all take place. So now the question to ask is what are the complications of wound healing? Can there be a complication? Yes, complications of wound healing. Because if a wound is healing, inflammation will take place. Can wound heal with complication? Yes. We have basic complications like infection, hematoma, dehiscence. I will explain all these things. Other issues are cell death or necrosis, long-term complication like amputation was not caring for that wound. You know that wound can attract smelling. The reason that is why normally we give an infection. If you don't, not in the body, the wound attracted, and an infection and die from a wound. Commonest causes of wound healing, complication, infection.
Hello, sir. We can't hear you, sir. It seems you've muted yourself. We can't hear you.
Yes, are you hearing now? Are you hearing now?
Yes, sir. Yes, sir.
So complications of wound healing, infection, then hematoma. That place the wound becomes swollen. Then the wound can break down. The wound that was healed before can open up again. That's what we call wound dehiscence. And other things like that. But let's go to the next slide. Complications of wound healing. We have things that can occur early and things that can occur later. Things that can occur later include infection. Okay, no, early complications of wound healing. The wound can fail. The wound can fail, meaning that the wound refuses to heal. It can cause more bleeding. It can cause osteomyelitis. It can cause infection. Then later, the wound can also have complications, which are called the late complications. Example of late complication is chronic wound. That wound that was small, it refused to heal. It can form keloid or hypertrophic scar. I will explain this. The place can become very dark where the wound was found. Now let me look at examples because I believe images speak louder than words. So I think we can get some of these images. So look at this. This man has a wound, hot water poured on him, and you can see the way the thing has done his skin. His skin is just having excessive scar formation all over, scar formation.
Sorry, you are muted.
Sir, you are muted, oh.
Okay. Are you hearing me now? You're hearing,
Yes,
right?
sir.
Yes.
Okay, look at this next slide. Look at this small boy. He has a wound on his stomach, but it has formed what we call a keloid. I'm sure you have seen a keloid before. See it on the body. That is, the place was trying to heal, but the tissue that was healing was more than what the body could handle. So it forms a kind of a swelling. This is one of the complications of wound healing. The body is trying to heal itself, but the tissue that will help in healing is more than enough. The body can do and cannot handle it. That is the same thing you're seeing on the next slide. Keloid. Keloid is common in women, it's common in black. Some people have it on their chest. A small wound, later they form something, a hard swelling. It's different from hypertrophic scar. Healing, these are complications of wound healing. So one of the complications of wound healing could be hypertrophic scar or a keloid. In keloid, there's an accumulation of excessive amount of collagen. In hypertrophic scar, there's also accumulation of excessive amount of collagen. Collagen is the thing that enhances the healing, the tissue. And in hypertrophic scar, there is raised abnormal scar. In keloid, there's also raised abnormal scar. But in keloid, but in hypertrophic scar, original wound, the growth in hypertrophic scar as against keloid, which is on the between the border of the original wound. Number 4 difference, keloid does not regress. Keloid does not regress. Keloid does not
You are muted, sir.
So, how do you know whether this is a keloid or how do you know whether this is a hypertrophic scar? Keloid does not regress, but hypertrophic scar can regress. Now, the next difference is a hypertrophic scar can be due to traumatic injury or hot water, anything that brings heat, but keloid is based on individual cell predisposition. That is a keloid. It grows beyond the original one. Hypertrophic scar grows confined to the original one. Then keloid is what you are seeing. It does not grow. Keloid is on the right side, does not grow. It grows beyond the original one, but hypertrophic scar does not grow beyond the original one. So, however, we say that healing can occur. What is the role of nutrition in healing? This again takes us to natural medicine. Whenever someone has a wound that needs to be healed, food and feeding is very important. The things that enhance wound healing includes nutrition. And talking about nutrition, one of the things that is very important to enhance wound healing is carbohydrates, because carbohydrates form an essential component of the immunological part of the body, the hormones and the enzymatic function. And then when someone has good nutrition intake from taking carbohydrates or proteins, that can help him to grow very fine. So proteins provide amino acids, and most of the cells in the body, including the skin, they are all proteins. And these form the building blocks of tissues. Other things that can also enhance healing is fats. High intake of monosaturated fat, they are thought to promote healing. Same with vitamins and minerals, especially vitamin C is very important in wound healing. Vitamin C. Folic acid and vitamins are also very essential in wound healing. Vitamin D is also very important in wound healing, especially if it is a fractured bone. Then vitamin E is an antioxidant. Vitamin K helps in blood, it arrests bleeding. And all these things are found in meat, in dairy products, in eggs, living vegetables, and so forth. Taking a lot of water also promotes wound healing, because blood flow and nutrient supply are affected by the level of water in the person's body. So in summary, we have been able to say that inflammation is how your body responds to an injury, and this can be acute or chronic. Acute, chronic are the two types, but chronic can last for years, whereas acute is just for some days or hours. All right, thank you very much. I think we can come to the end of this lecture. I'm grateful. So let me get your feedbacks.
Thank you, sir.
Good afternoon, sir. Hello, sir.
So I don't know whether you guys have questions so far.
Hello, sir.
Yes, please.
Please, I want to ask about This, sometimes we have birthmarks that eventually begins to grow big.
Yes.
Under what category can we call such growth?
Yes, bed marks. There's another topic called pigment. When we talk about body pigment, some people are born with some bed marks. That is where we are going to talk about bed marks. If you notice, bed marks is not because the person had an injury. It was just the person was born with it. So those ones we'll talk about it in another lecture called pigments of the body.
Hello, sir. Good afternoon, sir.
Yes, Olukemi, good afternoon, sir. I'm with you.
Thank you for the lecture, sir. I want to ask, which one is better to be taken? Where you said we should advise that our patients are having this high blood pressure or thereabout that they should prefer fish to this. I was trying to ask about chicken. Is it chicken better than beef?
Okay. Yes, in terms of cholesterol, do you see that skin? That skin of chicken. Are you listening? Miss Olukemi?
I'm listening, sir. I'm listening, sir.
The skin, that chicken skin, that skin is very high in cholesterol. Very, very high. Very high. So it's not too good to be taking it all the time for someone that has high blood pressure, because once cholesterol is high, it's going to increase the blood pressure. So we normally will rather say fish. Fish is protective because it will mop up the cholesterol that is bad in the body. But if you do meat, red meat, chicken is going to increase the cholesterol in the body, and that is also not too safe for the person. Do you get
Good
Okay,
evening,
thank you.
sir.
Okay, yes, good
Hello,
day.
sir.
Yes,
Good
Hello,
day.
sir.
Yeah.
yes, I'm with you.
Okay, sir, you
Okay.
said that there are two basic tests to confirm inflammatory marker. So I want to
Yes,
ask, in the case of cancer, so
mm,
those, that see biopsy, there are researches that says that in natural medicine that it's better not to do biopsy. So why are our patients, why are the doctors not opting for these inflammatory markers test instead of doing biopsy in case of tumor? Especially when these inflammatory markers can tell somebody the extent to which there is a higher response of inflammation in the body. So why are they opting more for biopsy in case of the inflammatory tests?
okay, thank you. Thank you. Now, first, let's get it clear. Inflammation is not cancer. Cancer is not inflammation. But the truth is that when cancer is formed in the body, the cells must have gone through what we call mutation. The normal cell has undergone some changes to become an abnormal cell. That is what forms cancer. Inflammation may play a role initially, but what finally will lead to cancer is, if you recall one of those lectures we gave, we talked about dysplasia. Dysplasia, normal cells becoming abnormal cells, then becoming cancer cells. So different from cancer. That is why, if what is happening in cancer, the way they operate, change their appearance, so it is beyond inflammation. Inflammation is just like a swelling, a pain, and all those signs of inflammation we give, but cancer is beyond that. That is why, usually, if somebody has a cancer, any standard hospital would take a small tissue of that cancer, what we call biopsy, and check it under microscope. What are they checking for? They want to see the type of cell that is growing there. Is it normal cell? Is it abnormal? Most time it's going to be abnormal. Even if it is abnormal, how abnormal is this? And how do we characterize it? That is the essence of biopsy. From there, they can know the particular type of cancer, and that can be managed. So inflammation, somewhat different from cancer. All right.
Okay, sir. The question I have is, you talked about the skin of the chicken skin, and you said it has a lot of cholesterol. Now, I know that most of the time it's not about it may not be about the chicken and the skin, but like what is in the skin of the chicken, of the particular chicken. Okay, so I want to know, is it the agric chicken like now? Because I know that mostly in our literatures, when they talk about chicken in modern times now, they are referring to what we see as the agric chicken or so. Now, the local chicken, is it the same risk? Does the skin of that chicken have the same risk of cholesterol like the so-called agric chickens?
Okay, I think what will answer to that is a lecture on nutrition. I don't know whether you people do a lecture on nutrition. There's supposed to be a lecture on nutrition because there's what we call
Yes, sir. We have a nutritional class.
yes, that nutritional class will tell us various substances and food, either meat or fish, and the content of each one of them. And to be very candid, sir, Mr. Peter, that is where the answer will come. If the nutritionist will tell us that the chicken fat, the chicken skin of agric and that of normal chicken we rear, they are the same, they are not the same, that answer will lie with them. But to be very sincere, I know very well that the cholesterol content of the skin of chicken, normal chicken that we used to take in Mr. Big, so that's the one I'm referring to, Mr. Big, all those ones, that one has high level cholesterol. That is the truth.
I understand. Yes, thank you very much, sir. Appreciate it.
Okay, thank you. All right, so I think, is there any other person? If there's none, we can call it a day, and then we'll send the slides to you guys, and then the one that is recorded, we will also find a way and send them. I hope that is okay. All right.
Yes, sir.
Thank you.
So don't forget the notes, particularly the notes itself.
Yes, I will send the slides, the note to you people as well. All right. Thank you.
Thank you, sir.
Yes.
Thank you, sir.
All right. Okay, bye. Yeah.